Welcome to another edition of EdTalks. I have a friend with me, Mahesh Rajamani. And Mahesh, you are the global leader for Tech Mahindra Healthcare, Life Sciences. That's pretty cool. Welcome to the show.
Happy to be here. Thanks for having me.
Yeah, well, I wanted to talk to you because obviously, just in full self-disclosure, I used to serve at Tech Mahindra and I really loved my experience and enjoyed it. And we overlapped a little bit. And I love what you're doing in the industry and how you're helping organizations. And I get questions all the time from various hospitals and health systems, like how do I take out costs or what do I do with AI? Oh, all those sorts of things. And that's something that you all are pretty keen on. So I wanted to dive into that a little bit. But before we get there, tell us a little bit about yourself.
Sure. I've been a technologist, servicing in the IT services space for over 25 years. The last 20 years, I've been in the intersection of healthcare and technology, and just the complexities around healthcare technologies is kind of so intriguing, right? When I came to this country 20 years back, the first thing that struck me was how complex the healthcare system is here, right? Having a family with two kids, it was understanding the benefits, what is covered, what is not covered, and complex terminology, scope A, detectable. It was all alien to me coming from a different country. And the interesting part is I couldn't even figure out what is the cost of a service. It was so opaque. You have been a healthcare executive yourself, and I'm sure you can relate to what I'm saying. And interestingly, I had a chance to spend time with some providers, payers, life sciences. When you talk to these executives, they have so much different ideas and the layers and the complexities. And I always felt that probably technology is the way to reverse this. What is happening, especially with the cost of care going up and the quality of service declining, right? And given what is happening in the industry with the new age technologies, whether it is VR, Gen AI, computer vision, you name it, I feel that the prospects are so high right now to make an impact in the healthcare space. And that keeps me excited. And like I said, I've been in this country for about 25 years now. So, uh, you know, just exciting. I feel that the exciting days are ahead when you look at technology and what it can do. So,
Yeah, absolutely. And again, I know you've been in this space for some time, and certainly Tech Mahindra, healthcare and life sciences. Can you share an example or two of some customer success stories, like how you're helping them?
Sure. So just from a Tech Mahindra perspective, right, we are a 6.5 billion organization, a global organization, and healthcare is a key part of it, right? We are committed to healthcare industry. We feel that we can make a tremendous impact. In the last 5 years, Ed, we have acquired a lot of digital solutions and capabilities that we feel will be in the forefront of transforming the industry itself, right? I'll give you a couple of examples, especially when it comes to providers, right? Uh, you might know that the typically a clinician spends 40% of their time just doing administrative work, right? We talk about clinician burnout. You know what I'm talking about. We feel that we can use technology effectively, and we have brought in and deployed solutions like ambient listening, where an AI tool set can listen in to the conversation between a patient and a physician and create a transcript of that and summarize it, translate it for easy understanding by the patient, and also even pull up diagnostic codes out of that discussion and trigger the revenue cycle process for faster collection. So this entire process, which used to be pretty cumbersome for the clinicians, we have made it easy and more effective, and also the experience is seamless for the patient, right? There are other areas also we are looking at where, say for example, a length of stay and risk stratification is another area. We feel that there is a tremendous opportunity to use AI, Gen AI, and make an impact. Just from way we operate, we work with 200 plus hospital systems today, right? And we are the technology backbone for these hospitals. What that means is we do pretty much all the functions, right from service desk to field services to network to security operations to clinical application management, all of it, right? Our playbook is very simple, right? When we go into a hospital system, our job is to deliver a best in class IT operations. The way we do it is we are leveraging the technologies that's available in the market right now, whether it's AR, VR, for example, in field services, we are using smart hands, using augmented reality for experts to sit remotely and solve problems in the hospital without being there physically. Things like that we are doing, which one is improves the experience for the clinicians, which is a huge issue today. Second is we are able to deliver at a very different cost point. And that's what we call as a technology arbitrage, where the today's technology has so much capability that we are able to disrupt and also improve the efficiency. At the same time, are able to deliver better experience as well. So we are super excited about what we could do given what's happening.
Yeah, those are great examples and very, very common challenges that my colleagues in healthcare are experiencing, and that's great solution set that you all bring. How would you define success? What does success look like for you as a person, as a leader, and also for Tech Mahindra?
Well, healthcare business has been the fastest growing for Tech Mahindra, and we are very proud of that. But what is more important for Tech Mahindra leadership and me is our ability to solve complex healthcare industry problems, working with our clients, and create an impact in the lives of patients and the communities we serve. So that, in a nutshell, is more important for us as growth comes with it as a byproduct. But we are very proud of what we could how we could leverage technology to improve cost of care, quality of care, and experience of care.
Yeah. No, that's great. And again, full disclosure, my long history with Tech Mahindra, so I don't want to come across as a commercial or anything, but what I appreciated was the fact that you're cross industries. And so I was always able to tap into what people were doing in other industries to sort of transform them, bring them over into healthcare. So it just makes your solution set that much stronger. So I always appreciated that about you and Tech Mahindra. Mahesh, this has been great. Thank you for being our guest and sharing a little bit about your perspectives.
Absolutely. Pleasure.